Sarah Spelsberg and Jessica Pelkowski, and they are both ARNPs, and Sarah is an instructor at the clinic in orthopedic surgery. She also has a master's in clinical medical science. Jessica has a master's in gerontology and primary care, and she's in the DNP program as well. They've got a lecture for us on how to incorporate APPs into your practice. I think it's going to be quite useful, so I'm going to turn it over to Jessica and Sarah.
Thank you to Dr. Waller and Dr. Phillips for having us here. I'm Sarah. I'm a PA part-time at Mayo Clinic in the Department of Orthopedic Surgery.
And I'm Jessica. I'm a nurse practitioner working full-time Department of Orthopedic Surgery at Mayo Clinic. And like he mentioned, I'm currently getting my doctorate degree through the University of Florida right now.
And so I have had the unique privilege lately of traveling around to different practices all over the nation and seeing in a lot of different ways how advanced practice providers are incorporated into practices. And there's tremendous, tremendous variability. And also in people's understanding of how to even start. And so that's why we put this talk together. We thought we could clarify some things, give people some resources for how to find what the laws are in your particular state, because they do vary some state to state, and also different practice models so you can see different examples of how people are utilized. We have no financial disclosures, no off-label uses. And the learning objectives are that we want you to gain a better understanding of what the similarities are between PAs and NPs, also understanding that there are some differences, and how to find the regulations that are associated with your particular state. We're more familiar with some states than others. And as well as to quell some of the misconceptions about what an advanced practice provider or mid-level can do. Most places are trying to get to the term advanced practice provider with regards to PAs and NPs. So a lot of misconceptions as to what we can or can't do. Mm-hmm. For example, we can't do injectables. Well, then I shouldn't have injected that guy's knee on Friday. We can do injectables, but we just have to be trained. That we can't prescribe medications. We can, and those laws vary state to state. For example, Florida just recently gave advanced practice providers permission to write for Schedule II.
For the prescribing medications for physician assistants, they have to have a list of classes that they can prescribe, has to be signed by their supervising physician and